My name is David and I'm a Prescribing Support Assistant working with the Regional Prescribing Support Dietetic team throughout the 5 trust areas in Northern Ireland. Malnutrition is a major public health issue, and recent data in Northern Ireland has shown that approximately 30% of people in hospitals and around 30% of people in care homes are at risk of malnutrition. Quite often, to treat malnutrition, patients are prescribed oral nutritional supplements by their GP practice. Our team's aim is to assess the prescriptions of oral nutritional supplements in primary care with the goal of ensuring these are currently appropriate to the patient and also cost effective to the GP practice. Our team promotes a food-first approach in addition to identifying and assessing adult patients who have been prescribed oral nutritional supplements and are no longer under the care of a dietitian. As a prescribing support assistant, I carry out a variety of different tasks. We prioritise GP practices based on their oral nutritional spend, and we offer our service to them. So unlike other services, our team do not receive patient referrals. So instead, us as prescribing support assistants will go into the GP practice and gather data, including patient demographics, their weight histories and prescription information. And we do a lot of work to evaluate this data to ultimately generate a patient list. We're looking for people who will meet our service criteria. We work very closely with GP practices and we finalise that list, and then we offer them an initial assessment and up to 3 reviews with one of our prescribing support dietitians. Throughout the service, we liaise closely with practice managers and practice-based pharmacists. Some of these skills required for my role include ICT and system operating skills. We work very closely with GP practices, and their operating systems on their computers are quite unique. You wouldn't usually have experience working with those systems if you've never worked in a GP practice. We also require some organisational skills and lone working skills. As we are a regional team, we quite often do work alone, so you need to be able to be motivated and be able to prioritise your work and be able to communicate that also with other team members. It also involves the need to be very adaptable because you need to go to different areas to work, different places around Northern Ireland. I think also having a bit of background knowledge on primary care and service delivery and also medicines management would also benefit someone who wants to come and work in the Prescribing Support Dietetic team. I decided to become a prescribing support assistant because I had originally heard about the job advertised for this brand new team, the Prescribing Support Dietetic team, and it sounded very interesting. I had been working in the health service for about 4 years before that. I was a pharmacy assistant and then a senior pharmacy assistant, and I really enjoyed that role. Before I worked in the health service, I had been working in jobs that I felt that didn't really help people, and that was something that I wanted to do. I wanted to know that at the end of the day, my job meant something and that I could help people. And I very much have got that working with the Prescribing Support Dietetic team. You feel that you're actually doing something with your life when you're working, that your job is actually helping people. So the research that I carried out before applying to become Prescribing Support Assistant involved researching the role itself. I'd heard about the new Prescribing Support Dietetic team that was going to be starting in Northern Ireland. So I carried out some research online about that. I had some previous knowledge of health sciences from previous study. I had also worked as a healthcare assistant within the NHS, all of which aided me in becoming and applying for a Prescribing Support Dietetic role. The route that I took to become a Prescribing Support Assistant involved having GCSEs in science, maths and English. I also carried out a BTEC in health sciences at the Northwest Regional College in Derry. I then also moved on to study a BSc Honours in Health Sciences with the Open University. I started that before my role with the Prescribing Support Dietetic team, and then completed it while working as a Prescribing Support Assistant. So I would recommend anyone to apply to become a Prescribing Support Assistant or to work with the Prescribing Support Dietetic team. It's a unique and innovative team to work with. It's based in a primary care setting and involves a variety of work. There have been many opportunities within the team to work on various projects and service development, and it has helped me massively in my career.